We had the pleasure of sitting down with Usha Kokatay. She's absolutely wonderful hospice care nurse. She's the director of nursing at Community Care and Hospice located in Camarillo, California. She actually helped myself when my mom passed away, so she means a lot to me. Hopefully you get a lot from this interview, and I hope you enjoy.
My name is Usha Kokatay. I am the Director of Nursing and the Administrator for Community Care and Hospice. We're located in Camarillo, California, and we've been here in this location for approximately 8 years, but we have been in hospice for about 14.
To start with, can you explain to us what is hospice care?
Yes, so hospice care is a way of living when patients have an advanced illness that is considered to be a terminal diagnosis with a lifespan of 6 months or less. Sometimes the life expectancy exceeds the 6 months, but hospice can maintain care until the very end. So hospice provides care for patients not only physically, but emotionally and spiritually.
What is the difference between hospice care and palliative care?
So hospice care is essentially comfort care. It's when there are no cures, there are no, it's not a curative program, whereas palliative can manage symptoms and will do everything to help that person recover from their illnesses.
Okay.
Hospice is really for comfort and management of the patient with no cure.
Okay. Who qualifies for hospice care, or what qualifies somebody for hospice care?
So patients, again, who have a terminal illness, patients who are declining in their health, frequently going back and forth to the emergency room, and patients who are really in need of not only management of their illnesses, but very good pain management. We deal with all of those things. So we take care of not only the physical aspect of the patient, but also the emotional aspects that go on with a declining health and the possibility of terminal ending.
I know you had mentioned pain management. Besides pain management, are there any conditions that hospice is, known for treating or helping with in a terminal patient?
Oh, absolutely. So wounds happen to be a very hot button for a lot of patients that are bedbound. And so we really do specialize in managing wound care. And sometimes if the wound is really, really an aggressive wound, we also partner with other wound care companies in the local area to manage wounds. And that includes all of the treatment plan and all of the equipment, all of the supplies. Wound management is a huge issue for hospice companies. Yeah.
If a patient decides that they want to move towards comfort care and not continue with curative measures, or, not continue to cycle in and out of the hospital, and they are actively declining, what does that look like in terms of how their care changes, or do they maintain their previous physicians, or how does that look?
So when a patient and family decides that they no longer want to seek curative care, then we step in and we explain the whole process to them. We let them know that we will manage all of their medical care related to the admitting diagnosis. So for instance, if someone comes in with a history of, say, lung cancer, end-stage lung cancer, then Medicare covers that diagnosis 100%. But if they have, say, cardiac disease or diabetes or any other diseases, they can still follow up with their doctors for treatment for those other diseases if they so desire. Or they can relinquish that and let our doctor manage everything. But they are still entitled to be followed by their primary if the primary is willing to continue taking care of them.
Oh, that's interesting.
Yes.
I didn't realize that.
Yeah, so you don't have to give up all of your doctors, in other words.
So to qualify, a doctor has to give them like 6 months or less to live, correct? Is that how that works?
The basic guideline is it has to be a terminal illness with 6 months or less.
So I don't think it matters the diagnosis, right? Just as long as it's like end of life.
Correct. And then also the decline of the patient. So initially we have a lot of patients that when we first get them, they look great. You know, they're not having very life-limiting symptoms immediately. But for instance, dementia patients can have a dementia diagnosis 2 years or 3 years prior to the end stage. So the stages of your disease really dictates when a patient should be considered for hospice and if they should be on palliative before. Just having the explanation of the disease processes is very, very important to deciding when is the correct time to place someone on hospice.
So if there is a diagnosis that's, eventually could be terminal, when would be the right time to start looking into hospice care or looking for a hospice company?
I would say the best time would be when you start noticing a decline in your family member. And what that looks like, it could be very subtle. For dementia patients, for example, the behaviors become very repetitive or they're very forgetful and they start losing the ability to walk, or they may have issues with safety where they're leaving the stove on and forgetting, where the behaviors just really, really change. For patients with cancers, for instance, rapid weight loss, frequent visits to the hospital. The same for cardiac patients. The symptoms, they may be more short of breath than usual. So anything that's a debilitating decline. Now, one of the frequent statements I receive from a lot of families are, we wish we had known about you before because they're suffering, the patients are suffering, and that's really unnecessary because we're here to provide comfort and care for these patients. So when you start seeing a decline in the patients, that's the time to really start considering looking into hospice. Because hospice is not like a Dr. Kevorkian. We don't come in and overdose a patient and end the life of the patient. We really are here to supplement that patient's symptoms so that they're not suffering and they're having dignity and having a sense of honor in their decline.
I'm a nurse, so I understand that there's a vast array of hospice companies. What is the difference in different types of hospice companies? And then what should a patient or family look for when they're looking for a hospice company?
Very good question. So if I were looking for a hospice company for my family, these are the things I would look for. One, the location. You never want a hospice company that's more than maybe 45 minutes to an hour away from your home in case of an emergency. Because if your loved one starts having shortness of breath, for instance, you don't want to wait an hour before someone can attend to your person. So you want to see the quickness and responsiveness. If you call your hospice company, you should get a call back relatively quickly. So that's one of the things I would look for, location. The second thing would be look at the reviews for that specific company that you're thinking about and compare it to other companies. Look at the differences between large companies and smaller companies. Generally, smaller companies should respond more quickly and will probably give you a better one-on-one care. Not saying larger companies wouldn't, because there's some fabulous ones out there. But do compare hospices. The choice of a hospice really is with the family. You don't have to go with whatever is given to you. I would say do a lot of research as far as that goes. And then, of course, family and friends are usually a very good resource. And That's another thing a lot of people forget about. Ask your friends, ask your family, hey, have you ever had to use the hospice? Who would you recommend? And those are some of the things that I would do.
So what does that look, the progression of hospice care, what should it look like with if you choose a good company that really is doing what they're supposed to be doing, what does that look like for a family or for a patient that's getting care?
Okay. So initially, we would manage the symptoms. So when the patient is awake and alert and oriented, we closely start educating what's going to come next. What is the disease process? We talk about symptoms. We talk about things that they're actively going through. Mm-hmm. So everyone is aware of, okay, this is what's happening now. And then when they progress to the next step, we tell them, okay, this is what's happening now, and this is what you need to be mindful of. Mm-hmm. And then when the patient starts to getting to a point where they're actively beginning to decline, we also let the family know and the patient, if they're coherent, of what to expect. So it's a step-by-step process, mm-hmm. because that's how our bodies change. And that's how diseases mostly progress. As it progresses, you will have different symptoms and signs and so on. And we teach and educate step by step. So we do have a 2-week meeting. It's called an IDT meeting. Mm-hmm. And it's where we discuss the status of the patients and where they are in their health and decline. So the whole team is aware of what's going on. Mm-hmm. And the team consists of a chaplain, and the chaplain does not preach to anyone. He just provides really wonderful emotional, and if they require, spiritual counseling. We have a social worker that assesses the patient, and all of this happens on admission, of course. She will see if there's anything that's needed that the family can benefit from, and if they're available to them, she will make that happen. And that includes in-home health support services, along with help with advanced directives, anything like that that a family may need. We hospice provide aids to help with bathing and linen changes and just general care that may be required. And of course, you have your nurses that come by. The frequency of your nurses also depends on the needs of the patient. Sometimes it could be once a week, twice a week, 3 times a week, and even 5 times a week if the patient so requires. Also, we have PT for those patients that could benefit from that, OT and speech, also a dietitian. So it's a very full and comprehensive team that comes along with hospice care.
So once a patient is on hospice, can they change their mind and decide that they don't want hospice? And what does that look like?
Of course. So absolutely, yes. A patient can decide that they no longer want hospice, whatever the reason. And that's a very simple call to the hospice company to say, we're no longer interested in hospice care. And it's simply there are 2 ways you could go about that. If they're wishing to transfer to a different hospice, form is implemented and the patient can be transferred to a different hospice without any issues whatsoever. And also if they decide, they want to end hospice, perhaps pick it up at another time, just have to inform the hospice company. Okay. So there's a revocation that's involved, means they're revoking hospice, or there's a transfer if they wish to go to a different hospice.
So if they chose a hospice company, say they're leaving the hospital, they choose a hospice company, they get home and realize, I don't want this company anymore, or I don't like their care, or whatever the case may be, they can make a choice to change?
Absolutely, yes.
And there's no, what would the term be?
No ramifications,
for that.
Insurances and so on.
Okay.
Yeah. So a lot of times people are really, really wary about being afraid to change. And I want to encourage people, it is their right, it is their choice. Hospice is never really a decision that's to be made by your physician. He can suggest hospice, and he may offer some suggestions to which companies, but the end choice really belongs to the patient and family.
How is hospice care typically paid for?
Hospice is covered by Medicare, Medi-Cal, private pay, and insurance. 100% by Medicare, Medi-Cal, and usually also by 100% by most insurances. It just depends on the plan the patient may have.
And so when you say 100%, is that for a certain time frame typically that it's covered at 100%?
Yes. So it's usually 6 months.
Okay.
That's what's given. However, the patient can be recertified and payment will continue. But Medicare allots 6-month period of time for hospice care.
Okay. Do you know how it works for somebody to be recertified? Like, say they are given 6 months with a terminal illness, but they end up living longer or doing better. What does it look like if they start getting better? And then also, what does it look like if they would need to requalify?
Okay. So that's a very good question, because patients do recover in the sense, even though they may have a terminal illness, and initially it happens a lot with us, we get them on board and they're very, very sick, but we actively manage a lot of their symptoms to where they become much healthier. And when we see that there's no decline going on for a period of a month, we actually graduate them from hospice, and so they can conserve their days when they really, really need care again. So that's when we would discharge them, and we let them know that we're still going to be on standby if they have issues with decline again. So recertification is where our physician would come in, reassess the patient, see where they are in their decline, and if they still need hospice care, then they're recertified. We do have to follow very strict guidelines, making sure that they're meeting those, but they will be requalified and continue with the care.
So if somebody's in the hospital, typically they're given like a list of people, a list that the hospital provides them. Do they have to go with somebody from that list? And is hospice care still covered by insurance if the company's not on that list?
Absolutely. Yes. No, they don't have to go whatever is on that list. Again, it would be finding, again, the location of that hospice to your home, looking up the reviews, and then just doing a little due diligence on your part. It can be very overwhelming because, again, larger companies will have a lot of advertisements, but I would just pick 2 or 3 of people on that list and maybe take a look that way. But again, it's really due diligence. So you're not obligated to go with what's on the list or what's recommended for you. Just do your own due diligence.
Where could somebody have hospice care? It could be like in their home potentially, or like a boarding care, skilled nursing. What does that look like, or what are the places that they could go with hospice care?
So generally, all of the above that you mentioned, home, wherever the patient is actually situated, whether that be a short-term stay in a hospital, if it could be in an assisted living, it could be in a nursing home, it can be in their own homes, and it's wherever the patient actually is residing.
And so then you would make your visits to wherever they're currently living.
Absolutely.
Okay.
Absolutely.
And so if the patient were going to be at home with hospice care, are they able to get like medical equipment that they may need for in the home? What does that look like?
Yes. So all the medical equipment, or the DME, which is usually what it's referred to, is provided and covered by Medicare, as well as and Medi-Cal. And along with all of the medications that are associated with the primary diagnosis, all of that's covered. And any supplemental needs for diapers, wipes, things like that, for personal care and grooming, that's also provided by the hospice company. Oxygen, wheelchair, walker, all of those things.
Once the equipment's delivered to a family member's home or to the patient's home, is family expected to help take care of the patient? Are they expected to help with medications? Like, what does it look like in terms of, hospice involvement and family involvement?
Very good question, because there's a lot of confusion surrounding that. So Medicare allows for a 1 hour's visit for each discipline. So when the nurses come in, they're there for an hour and so forth. Those are the recommendations for Medicare. So unfortunately, the care of the patient is with the family. One of the requirements are there must be a caregiver 24/7 with that family. And unfortunately, at this point, it's not covered by Medicare. Of course, there are exceptions to different companies and how they choose to manage their practice. With our company, we always let our families know that we're there on call 24/7. So if something should happen to that patient in the middle of the night, they're not alone, and we will go out to manage the care of their patients. And we usually will stay until the situation is resolved. But the general expectations are, and a lot of people have this misconception that once the patient is on hospice, that there will be someone 24/7. And unfortunately, the answer is that's not covered by Medicare.
So when you say somebody typically there has to be a 24-hour caregiver, that just means that somebody has to be present with the patient 24 hours a day.
Correct.
Which could be family,
It could be a private caregiver, it could be the family, friends, depending also on the diagnosis of the patient.
Okay. Whenever somebody is, dying, what does end of life look like? How do you describe that to somebody that doesn't really understand what that might look like?
Yeah, of course. So a lot of people are just really terrified about the end of life. They're not sure what the next step is. As hospice nurses, we educate our patients and families very honestly, step by step, about what happens when the patient is actively dying or transitioning. And that period is called continuous care. It's where we stay with our patients and we give them comfort medications every hour, and eventually they do pass. Now, in that passing period, we encourage the families to be close by and to let them know that it's okay to come in and let their loved ones know they're not alone and that they can still hear them. But it's not something to be feared, the end of life. Patients do sometimes have difficulties with respiration, so the respirations do change and the vital signs do diminish. But when the patient is cared for properly, it's a very, very peaceful ending. Mm-hmm. And it's not something to really be afraid of.
Mm-hmm. So how long have you been a nurse? And then kind of following up, what brought you into hospice care nursing?
I've been a nurse for more than 40 years. That kind of dates me. But what brought me to hospice care was the passing of my husband's brother-in-law's wife. And she was a physician in Orange County. And I never thought I would really end up in hospice because it's very emotional. You just get so wrapped up in the families. It draws your heart. It's very, very good and bad because you bring a lot of peace, but it also takes a toll on you because we do love our patients. Anyway, she had a very bad ending in a hospital, and I was asked to come in and see what I could do to help the family. And I ended up doing hospice care for her, and it really moved my heart. And when I got back, I was working at the Spine Institute, and I had a really great job there. It was a very good work situation for me, but I felt really moved to go into hospice, and then an opportunity presented itself, and I took it, and I've had no regrets ever since. Hospice truly is an amazing part of nursing, and it's a very, very special call.
Yeah, it takes a special person to be able to give of themselves in that way, but also kind of have emotional boundaries too.
Yes.
I'm sure it's a lot. Yeah. I just want to thank you so much for meeting with us today and explaining your company and explaining hospice care. Thank you.
You're very welcome. Thank you for giving us the opportunity to do so.
Thank you.